Assessment demonstration. Here I will demonstrate myself interacting with a client who's needing a full genital, urinary, and sexual assessment. This will involve current sexual status and history as well. I will start by completing my K-wipes while entering the room. One thing I included in my K-wipes was asking the patient's preferred pronouns. Gender identity, one component of sexual identity, is the image we have about ourselves as a man or a woman. It is the internal experience whether we feel like a woman or feel like a man. Gender identity emerges from societal and cultural norms. Gender non-binary or non-conforming is a person who does not identify with a gender. They may go by different pronouns such as they, them, theirs when being referred to. Transgender is defined as a person whose gender identity is not the same as their assigned gender at birth. It should be used as an adjective such as a transgender woman or man, while also using their preferred pronouns. These are just a few examples of identities that you may encounter. A key point from our text points out that although there are numerous and different terms associated with the concepts of gender and sexual identity, you must focus on providing non-judgmental and quality client care. Barriers to care result from healthcare providers having limited awareness of clients' communication, social, and medical needs. Other accommodations for this assessment include the following. Older adults will need to be assessed for incontinence using SPICES. SPICES is a questionnaire used to assess risks associated with aging while using subjective and objective data. These risks include the following. Sleep disorders, problems with eating or feeding, incontinence, confusion, evidence of falls, and skin breakdown. Older women with arthritis, it may be difficult to assume the position needed for a genital assessment, which is the lithotomy position. Therefore, a SIMS position with additional support will be appropriate. Children will need parental permission, and you will need to explain to the child what you are going to do before touching them. Expect feelings of embarrassment or resistance. Do not perform internal assessments of an adolescent female unless the individual is sexually active. Minors have the right to privacy in most states, including Idaho, as little as age 14. The Idaho law states that no person in possession of confidential statements made by a child over the age of 14 years in the course of treatment may disclose such information to the child's parent or others without a written permission of the child, unless such disclosure is necessary to obtain insurance coverage, to carry out the treatment plan, or to prevent harm to the child or others, or unless authorized to disclose such information by order of a court. Another key point from our text includes, do not let your child's age, level of education, or life experiences lead you to make assumptions about their knowledge of sexuality. Moving on with the demonstration, I will show what a questionnaire-based genital, urinary, and sexual assessment may look like.